Niamh Burke and I'm the Communications Officer here at the Alzheimer Society of Ireland.
My name is Saoirse Kelly and I'm the Advocacy, Engagement and Participation Officer with the Alzheimer Society of Ireland.
My name is Diane O'DOHERTY and I'm the Research Officer here at the Alzheimer Society of Ireland. So we're going to share a presentation with you today looking at changing work practices to become more LGBTQIA+ friendly.
So just to tell you a little bit about the structure of our presentation today, we're going to give you a little bit of a background to the Alzheimer Society of Ireland, tell you a little bit about our team and the steps that we have taken so far by our team, and obviously, most importantly, what's next and what our next steps are. Our aim for today was that to share our learnings from our team's experience, but we want you to come away with some ideas on starting to identify how you and your teams can become more LGBTQIA+ friendly and diverse. So just a little bit about our background. So Winifred Bly and Imelda Gillespie met in January 1982, as they had a sister and husband respectively diagnosed with forms of dementia. As carers, they found that not only were they unable to access even the most basic information about Alzheimer's disease or dementia, but that information, support and facilities for families were non-existent. From their first meeting, they founded the Alzheimer's Society of Ireland and set about changing the landscape of dementia care in Ireland forever. Today, 40 years on, the Alzheimer's Society of Ireland is the leading dementia-specific service provider in Ireland. The Alzheimer's Society of Ireland works across the country in the heart of local communities, providing dementia-specific services and supports and advocating for the rights and needs of all people living with dementia and their carers. Some of the symptoms of dementia can have particular implications for LGBTQI+ people. For example, memory problems might make it harder for people to remember who they have told about their sexual orientation or gender identity. Therefore, we have to ensure that we're putting systems and mechanisms in place to protect and safeguard people using our services. Our vision is an Ireland where people on the journey of dementia are valued, supported, irrespective of religion, belief, disability, age, or sexual orientation. The Alzheimer Society of Ireland advocates, empowers, and champions the rights of people living with dementia and their communities to quality support and services, and we must ensure that our services and supports are welcoming to all.
So earlier this year, we and our wider team, the Advocacy and Public Affairs team, joined the LGBT+ Champions Training Programme. So this is aimed at health and social care professionals who are working and supporting older people. So obviously there's a great need to ensure that staff who are working with older people are trained and aware and that their services are inclusive of LGBT+ people. So we want the care experience of older LGBT+ people to be one of dignity, inclusion and respect and visibility. And the importance of this was really reinforced in the training. So in Ireland, as LGBT+ people get older, they're often forced into the closet due to a fear of not being accepted. And we really learned that if they can't be open about who they are with their health professionals, people who are caring for them, then this can actually be quite damaging. And their mental and physical health might be at risk. So it's really important that they feel visible, safe and assured that they'll be accepted, especially at their most vulnerable time. So the training was really quite empowering and it really broadened our awareness and fostered important conversations around issues faced by the older LGBT+ community. So we heard from older members of the community. We listened to their stories about their lives, their experiences, the challenges they have faced and continue to face. And their stories were really emotive. So we learned that it's not up to the individual to come out to us, it's up to us as an organisation to raise the flag and show the person that this is a safe space. And the team met to discuss it after, and it became clear that we all wanted to take action around how we as an organisation can best support members of the LGBT+ community living with dementia, which led us to establishing this LGBT+ pilot group.
Following on from what Niamh was saying about attending LGBT Ireland Champions training and developing a small working group, we then set a list of goals and tasks we hope to achieve over the next few months. We began this by building awareness. We also attended the LGBT Ireland conference. We also submitted this abstract for Alzheimer Europe conference. And we felt at this stage we wanted to let others know about what we were doing and implementing. We also had some discussions around ASI LGBT training needs and looking to expand our working group to include other themes. Most importantly this year, as part of ASI's pre-budget submission to the government, we asked for specific funding for LGBT+ support groups. Here to you some of the steps we've taken so far, but for us as a team and an organisation, we recognise that there's still so much we can do. We've outlined some steps here that we're hoping to achieve in the coming weeks and months. So we recognise that the images we share both internally and externally need to show a diversity of people we engage with. We want to do this in a non-tokenistic way. We're also recruiting for different working groups, which we are hoping to add new faces and voices to. We are continuing to highlight LGBT+ research, showcasing work that we've commissioned and also that of early career researchers. We are also working on a new equality and diversity charter that can be implemented across the organisation. We hope that this is included as part of the ASI's new organisational strategy coming out next year. We continue to ensure that our teams have best practices in place and that in time we can share that our team's wider changes to other teams as a pilot to show that we can make changes to everyday work practices to become more inclusive in a non-tokenistic way. So this is just some photos from LGBT Ireland's Pride 2022 healthcare conference, of which some of our team attended.
So our key message here is that developing an inclusive and diverse workplace culture can be challenging, but it is essential in workplace practice to ensure that every individual feels accepted. We as allies need to show up for members of the LGBT+ community living with dementia. So this year marks the Alzheimer Society of Ireland's 40th anniversary. And as we continue to strive to provide the best level of person-centred care for people living with dementia in Ireland, we will strive to shape work practices to become more LGBT+ inclusive.